What ethical dilemmas arise when competent patients refuse life-saving care? Imagine being in a situation where someone you care about refuses treatment that could save their life. It's a tough spot that raises many questions about what's right and fair. When patients are mentally capable of making their own choices, healthcare providers face complex ethical challenges. The core issue is respecting the patient's right to decide, even if that decision might lead to their death. This is called patient autonomy, and it's a key principle in medical ethics. It means patients have the right to accept or refuse treatment after being fully informed about the risks and benefits. But respecting autonomy can clash with the healthcare provider's duty to do good and prevent harm. That's where beneficence and non-maleficence come in. Beneficence means acting in the patient's best interest, while non-maleficence is about avoiding harm. When a patient refuses life-saving care, providers must decide whether to honor that choice or intervene to save the person's life. The decision isn't always clear-cut. It depends on whether the patient is truly competent, that is, able to understand the situation, appreciate the consequences, reason about options, and communicate a clear choice. Competency can change over time, so careful assessment is essential. If a patient is deemed competent, their decision must be respected, even if it seems unwise or risky. Ignoring their refusal could be seen as paternalistic and violate their legal rights. On the other hand, if a patient lacks capacity, providers may need to override their decision to protect their well-being. Justice also plays a role here, ensuring that decisions are fair and not influenced by external pressures like financial issues or access to care. Healthcare workers often find themselves emotionally strained when patients refuse treatment that could save their lives. It's natural to feel conflicted, but maintaining open communication and empathy is vital. Providers should explain the situation clearly, listen to the patient's reasons, and involve ethics committees if needed. Practical steps include thorough informed consent, confirming decision-making capacity, and documenting everything carefully. Respecting a competent patient's refusal is a fundamental right, but it requires balancing this with the healthcare provider's duty to do no harm. These dilemmas challenge us to think carefully about individual rights, professional responsibilities, and the importance of clear communication. Ultimately, respecting patient autonomy means honoring their informed decisions, even when those choices are difficult or uncomfortable for everyone involved.